Welcome to a new addition to the SSP TV family. It's called Your Community Partner. And you're going to love this show, my friends. It's LVH Lehigh Valley Hospital Schuylkill. Now, you know we do a daily show with the Hazleton Hospital, Lehigh Valley, and now we're introducing the Schuylkill County Hospital, doing great things down here. And I thought a good opportunity is every quarter we'll come on and explain a lot of great things that are happening for you. And I've said this many, many times. The Lehigh Valley Health Network, just the bar keeps going up and up, and it's so nice to know that we have this kind of healthcare. And speaking of great people, Bill Reppy, who is the president, I know Bill from going back. Bill, congratulations on what you're doing here.
Thank you, Sam. I appreciate it very much.
I'm interested in the show. We have a great success with the Hazleton show, and every day they're on explaining what's happening in different, Tamio brings different guests on. But here in Schuylkill County, you know, you've experienced a lot of things, okay? But a little bit about you before we go into, so people who don't know you, who is Bill Reppy, you know?
Sure. So I'm Bill Reppy, president of Lehigh Valley Hospital Schuylkill. Born and raised Schuylkill County, except for a couple of years when I was in the military. I've lived here my whole life. So my family lives here, Sam. My friends, my loved ones live here. And so my commitment goes beyond just being the president. My commitment is because I treat my family and friends every day in our hospitals here. I
think that's critical because some people, you know, if you come in, you know, they don't know the area, you know the people. So you send your family here for health care, okay?
Correct.
We experienced something that I hope we never experience again in our lives, COVID-19. This hospital did many things, okay? So let's take us for the past and bring us into the future of what, you know, what you did to combat the COVID-19 situation.
Sure, thank you, Sam. So as with many communities, it was very traumatic for us. We had very high census of COVID. In fact, at one point, we had almost 100% of our patients in the hospital were COVID positive patients. And so that's, you know, tragic for the people that had COVID, but it was also pretty tragic for our colleagues. So they were coming in every day, you know, in spite of, you know, their worry about their own health to make sure that they cared for our community. And so each and every day, you know, they came in with the masks, the goggles, the gowns, everything, and fought through it. And honestly, Sam, as I walked around and talked to them, they were scared. You could see it in their eyes, but it didn't matter. They still put the patient first. And so that was a significant challenge for us, as it was across the entire United States and the world. But then, you know, as we moved on, you know, the vaccines came out. And so we here, as well as all the Lehigh Valley Health Network, started a vaccine clinic. We were very excited about that. You know, the energy of my staff and the energy of the community was just amazing. People couldn't wait to get in line for a shot. And normally they're not really running to the front of the line to get a needle. So that was exciting. And so we ran the clinic every day, 7 days a week for many months. And here in Schuylkill, we've vaccinated just over 27,000 people so far. And across our network, well over 400,000 people have been vaccinated. So, you know, I think Lehigh Valley Health Network and Lehigh Valley Schuylkill, we're really out in front of that. We set up the clinic early. We continued to run it 7 days a week when others slowed down. But unfortunately, Sam, the demand for the vaccine's waning. You see it on the news. You know, I know you report it as well. So, you know, we want people to get the vaccine. It truly is, you know, the tool that's going to help us get beyond this. And there have been hundreds of millions of people who have gotten the vaccine across the world, so we know it's safe. And so, you know, I encourage people to please get the vaccine. We still run a clinic here 1 day a week. I'd be happy to open it up more if there was demand for it. But we're partnered to try to get it out to the community as well. So we've gone to nursing homes, we've gone to high rises, and next week is the Schuylkill County Fair, and we're having a vaccine clinic at the fair to hopefully catch more people. So we're excited about continuing to vaccinate, but I'd encourage your fans to please get the vaccine if they haven't done so far.
What do you think the biggest fear is, Bill?
Well, I think, you know, honestly, politics plays into it a little bit. You know, and it doesn't matter which party you're from. There's been pros and cons on both sides. Both parties have, people in the parties have, you know, sometimes said don't do it, then sometimes say do it. So I think we send a mixed message. You know, and I think there's some confusion. And then I think there's also that it's still under emergency use authorization. And some people are a little nervous about that because it's emergency use. But, you know, people in our network, our physicians, our scientists that are way smarter than I am say it's safe. So I got the vaccine because I believe them. We were part of the clinical trial for Pfizer. We're part of the clinical trial for the phase 2 potential booster shots at our health network. And so I trust the scientists. I believe that they're safe. I believe because millions of people have gotten it. So hopefully people get over that anxiety.
Well, you saw the drop, okay, when more and more people were getting vaccinated. Then all of a sudden it went stagnant to a degree, okay? And I think here again, I talked to some people, I'm not getting the shot, you know, and I guess sometimes when someone gets a bad reaction, you know, and it's like anything else you may get a reaction from. Right. They only hear the negative thing, right. That one negative, but there's thousands of positive. Am I correct in saying that?
You are correct. So a very small percentage of the people will have a minor reaction to the shot. Typically a low-grade fever, you kind of feel almost like you have the flu. It lasts less than 24 hours, but that's less than 20%. Most people don't have any reaction to the shot at all. So
I had none. I'm a weirdo. I had none. You know?
I had a little bit. So I had a slight fever, and I got a little nauseous about 3 o'clock in the morning after my second shot. But I went to work the next day. I was fine. I functioned normal. So it's just that short period of time, and I said that I'll take that little bit of fever to be safe from COVID, because COVID kills you.
My friends, I encourage you, get the vaccine. Believe me, get vaccinated. You're looking at, I've said this on my show, the biggest baby walking the face of the earth right here. I went there January the 14th, got my shot. It was fantastic. February 14th, Valentine's Day, got the second shot. Thank God. So what do you think's happening now with, you know, when you hear about these people getting COVID, you know, is this second round who's getting COVID, is it as bad as the first round? What are the scientists telling you?
It has not been as bad just yet. There are some people that are still getting pretty sick from it. I think it's 90% of the people getting COVID now are the unvaccinated. Okay. So, you know, the vaccines are very effective, but there's only 95% effective. So there's some portion of people that will still get COVID. The good news is if you have the vaccine, it usually don't require hospitalization. You usually get over it at home. And so the vaccine at least prevents death.
Yeah. What more can you say, my friends? You know, I've been saying this for years in the Hazelden Market area with Lehigh Valley Hospital. I mean, the doctors, the nurses, all the medical staff have been fantastic. And what I come down here, has been here since 1999. This hospital, you know, does there's a great health care here. Absolutely. Talk about your doctors and your medical staff and how efficient they are.
Oh, we have a great team of really, really dedicated doctors and clinicians and nursing staff and support staff as well, environmental services, dietary workers. The old saying, it takes a village, Sam, to do what we do. So very strong, they're smart, they're clinically very sound, and we're doing state-of-the-art care here. We have the latest and greatest robot. You know, we have intensivists to manage our ICU. We have a chest pain center. We're a stroke center of excellence. We're really we're on this mission to make sure we have the highest possible quality we can for a community hospital. We're never going to be a Cedar Crest, Lehigh Valley Cedar Crest. They're a quaternary care hospital doing, you know, major open heart surgeries and brain surgeries. That's not what we're about. We're a community hospital caring for this community and making sure that we can take care of the things that are safe to care for in our community. And when we cannot, Sam, we transfer them to somebody else.
They can.
They can.
The thing I like about it, my friends, I've talked about this before, is that when you go to a doctor in the Lehigh Valley Network, you know, people say, I want to get second opinion. Well, you're getting more than second opinion sometimes. You're getting second, third, fourth, fifth, because they confer with other doctors.
Absolutely. We frequently consult specialists.
Yeah.
And sometimes that's by just through the chart. Sure. Sometimes it's a telephone consult. We actually use video technology, so sometimes if we consult a specialist in Allentown and they say, well, I'd like to see the patient, we roll a video card in, very super high definition cameras. It transmits all the electronic, you know, EKGs and everything, so that it's almost like being here with the patient.
It's fabulous.
And so that raises the level of care, quite frankly, for our patients.
Well, I'm excited about these shows, okay? I'm really excited. I mean, we're trying to get them on, and we're going to call it, thanks to Tammy, your community partner, and which they are, my friends. They're your community partner. They're here to help you, and you have no fear as far as healthcare is concerned. I've been doing this show since 1994. I've said it before. We have great health care in our areas here. This community has a great health care system. We come back, we're going to show you a video, and Bill's going to explain why they produced this video. I saw it. It's fantastic. We'll be back right after this. Well, welcome back, folks, to your community partner, Lehigh Valley Hospital Schuylkill, and it's a quarterly show. We're going to be informing you what's happening here in Schuylkill County and how this great hospital is working. My guest is Bill Reppy, the main man himself, the president. Bill, talked about this video. Tell us, I saw the video. It's great. Tell us why this video came to be.
Sure. So as we talked about in the first part, Sam, COVID and the impact on our colleagues. So we wanted to produce a video to really send a strong message of thank you. Because as I mentioned, each and every day they came in and honestly put their lives at risk because we didn't know a lot about COVID in the beginning. We continue to learn. And so we produced a video with myself, our Chief Medical Officer, Dr. Larry Riddles, and our Vice President of Nursing, Sue Curry, to really send a heartfelt thank you to our colleagues. And I can tell you, Sam, it was emotional when we did it. All three of us cried because, you know, we appreciate what our colleagues did, quite frankly.
And you could see that in the film, in the video. It's great. So, folks, take a look at this.
When the pandemic first hit a year ago, we were somewhat immune to it, if you will. We didn't see the big numbers, and you know, we were cautiously optimistic that, you know, maybe we could get through this unscathed. And then the winter came, and the second wave came. The number of people that were hospitalized was devastating. The number of seniors in our nursing homes, the number that passed, it was just tragic, tragic, tragic to see the impact that this has had on us.
The scale of this is global, and it really is eye-opening, and it's taken all of the things that we did every day, the regular maintenance of care and provision of care to the community, and had us then to prioritize, not push aside, but be able to address the immediate need, and that was that we had a contagion that was quite good at making people ill, and in many cases could make you a statistic. Not only were the patients contagious, but we could be as well, and we knew that 30 or 40% of coronavirus was asymptomatic. So the fact you felt fine didn't tell us that, so we had to deal with everybody, even our colleagues, as though we all had it.
The role of our staff has been nothing short of amazing. They have really adapted to changes that have had to occur at the bedside with our patients. So not only are they the clinician in that work environment and providing care, treatment, and services to the patient, but they've also had to step in and be the surrogate, if you will, for the family and the patient. And so, you know, we have done things with technology in terms of using iPads to FaceTime with family members, and the staff have been instrumental in making sure that those interactions could occur with our patients. But, you know, we've brought life into the world in this time of pandemic, and we've also held the hands of those patients who are dying. And so we've been the comfort for the patient when the family can't be there. And so that's been very challenging, because you go from the person who is saving lives to the person who is helping a patient put closure on their life. And so that has been very, very difficult for our staff.
There's an old saying that it's easy to be a good sport when you're winning, but the real sportsmanship happens when you're struggling. Yeah, and I would say we struggled.
You know, it's difficult when you're trying to manage the care of patients, but you're also trying to manage the care of your colleagues. It was very hard for us as an organization to watch our colleagues get ill. We watched not only our colleagues, but loved ones of our colleagues get ill. Some did not make it through their battle with COVID. And so those things have been very, very hard and very difficult. Certainly, I believe that our colleagues are resilient. You know, they come to work every day, they do their job, and they do it with grace and professionalism. And I think that it speaks volumes for the character of all the colleagues in the organization. There was a lot of fear here. We dealt with something that we've never dealt with before. There was a lot of learning and a lot of education, and there was a lot of concern about what we were taking home to our families.
Our community, they rallied immediately. Yeah, we received phone calls and letters and donations, and we had a lady in Ashland who sent me a letter that said she didn't have the wherewithal to send a cash donation, but she committed to making masks. We had corporations reach out to us, give us N95 masks. Local restaurants who honestly were struggling, quite frankly, themselves. They were shut down. They had no income, and yet they were making pizzas and macaroni and cheese and other things for us. Our community was here for us each and every day and continues to be.
To get a letter from a patient that said, you're our heroes, you are phenomenal, you've saved my life, or you were there to comfort my family member when in their last days, that's more meaningful than any gift anyone could ever give. To know that you've been able to touch a family member, to touch a patient, to touch a colleague's loved one in their time of need is certainly something that helped all of us get through this pandemic, and I think that it really has gone a long way to boost morale, to let the staff know that they're appreciated, that their work has not gone unnoticed, and that what they do is important to not only us as an organization, but our community at large.
Gilberton had a devastating flood. We went up there, as we had in the past in other floods, and set up a tetanus clinic and provided information about safety, provided some free first aid supplies for that community. We provided 4 AEDs to the Boy Scout camp. Proud to partner with the Boy Scouts. We also partnered with our local borough of Port Carbon. Again, didn't have the wherewithal to replace expired AEDs. We bought one for the police and one for the fire department. We started the first ever EMT training program within a high school. And when we were setting up the program and providing the funding, we thought, if we got 10 or 15 kids, it'd be phenomenal to start as a volunteer EMT. We got 35 kids in the first class.
There was a sincere gratitude, and I would say probably the greatest kudo we got from them was a confidence that if we said we had it, they'd move right on. If we asked for something, there wasn't a, well, do you really need it? It was, how do we get it to you, and so forth. So I would say that it was probably the biggest kudos. On top of it, our senior leadership was up here. Our president and CEO, Brian Nestor, came up in the middle of the pandemic and actually walked around thanking people. And that wasn't by accident. He felt very strongly about coming up and doing that. So we saw not only them virtually, but they also invested the time to come see us.
So Dr. Nestor will be joining this video to talk to us about his gratitude as the president and CEO of Lehigh Valley Health Network. I can tell you that every time he speaks to us, he sends a message. It resonates how proud he is to be the leader of this network, and how proud I am to be a partner with him to be able to deliver health care to this community.
On behalf of our board of directors, our executive leadership team, and most importantly, our patients, I have a special message for all of my colleagues in Schuylkill County. The message is this: thank you. Every day since you joined Lehigh Valley Health Network, you have worked tirelessly to make our health network stronger and our community healthier. You live and breathe our mission and values. You heal, comfort, and care with compassion, integrity, collaboration, and excellence. And you create moments that matter for our patients and their loved ones. Whether you provide patient care or support those who do, every colleague plays a critical role in our mission. Thanks to you, people in Schuylkill County know that when times are tough, the LVHN family has their back. They take comfort in knowing they have a team of healthcare partners on their side to guide and help them through their health journey. As we move forward together, let's keep delivering better and better experiences for our patients and their families. Unquestionably, you are making a difference in people's lives. For that, you should be LVHN proud. And for you, I am thankful and grateful. Keep up the good work, and from the bottom of my heart, thank you for all you do.
I can't think of anybody that I don't want to thank, because every day you were there helping us where we could and doing those things that we needed to do, and we knew we could depend on you. And just amazing, and special shout out to the nursing staff. You were through hell. Sincere thanks, Lehigh Valley Schuylkill, for all you did for the community, for the patients, for all of us. Thank you.
I would just like to take a moment to thank all of the colleagues at LVHS. You are amazing. From the individuals who care for patients at the bedside, our providers who offer their care, treatment, and services for our patients, all of our ancillary support teams, our housekeepers, our EVS folks, our dietary folks, everybody who impacts the care of a patient from the minute they walk through the door to the minute they go home. I'd like to thank you from the bottom of my heart. We could not have gone through this past year without you. You're amazing, and you should be so proud of the work that you've done.
So I'd just like to let the colleagues know that, I've watched their eyes, I've watched their actions over the last year, and I've watched their dedication and commitment to our community. And I saw fear, and I saw dedication. And I was proud of them, really, really proud of them for what they did each and every day. They came in, they took care of our patients, they were scared, they were worried about taking the disease home to their family, and yet they were here every day. I just can't tell you how proud I am of each and every one of you.
Thank you, Lehigh Valley Hospital Schuylkill. You rock.
Well, welcome back to your community partner, folks, Lehigh Valley Hospital Schuylkill. Great video, great video.
Thank you, Sam.
We talk about making investments and how it affects the healthcare. Certainly, this hospital and Lehigh Valley Health Network has done great. Tell me about the investment you made and what we have to look forward to.
Sure, thank you, Sam. So Lehigh Valley made a commitment to this community when we were selected as the partner to come here, that we would invest in capital and infrastructure, technology, all of the important things that make us a great community hospital. So we're here just about 5 years, and we've invested in excess of $80 million in a lot of great tools. As I mentioned in an earlier segment, we have a brand new state-of-the-art robot, re-outfitted our ORs. We brought an electronic health record that's fully integrated across our network. I mentioned the chest pain center accreditation, the stroke center accreditation. We're now looking for trauma accreditation. We're putting a new MRI in at our East Campus.
Is that right?
It's a $3 million investment. We think that it raises the quality for our patients. We currently don't have one there, and so we want to make sure we have one in the hospital. And so construction is fully underway, and we expect to be operational by the end of the year or early next year there. So while we have an MRI in Pottsville, it's just not at the East Campus. And so those investments are so important to us, and we continue to grow our physician group. So we continue to bring in specialists that aren't available in the community, full-time, part-time, depends on the specialty. And we also partner with Integrated Medical Group, a local large physician group, to help them recruit to make sure that patients can get the care that they deserve close to home.
How do you determine to what you expand in? I mean, is it a census that you take, or is it need of the community, to fill in different gaps? How do you determine that?
So we actually look at data, and so for physician recruitment, there are metrics that we use that say for, I'm going to make up numbers because I don't know them off the top of my head, but for 1,000 people, you need one family medicine doc. So we look at the data and say, when the data says maybe I need to add a family medicine doc, then we go out and recruit a family medicine doc. And there's data for all specialties like that. So that's on the provider side. On the technology side, we look at where we believe there may be a gap, or is there a new technology that we should upgrade to. And we involve the entire management team and the entire physician team to guide us on that journey. Because like everyone, while we spent $80 million, we don't have an endless pocket of money.
Yes. Yeah.
So we have to pick and choose each year on what we invest in.
And speaking of that, my friends, there's a phone number on the screen, okay? So when we're running this, it'll be a quarterly show. Great opportunity if you have any questions or any comments. You can always contact them at the phone number, or you can email me, sam@ssptv.com. Be more than happy to convey this to Bill and Mike, who's the public relations man here, to answer your questions, all right? I'm excited about the shows because, as you said, in Hazleton, every month we feature somebody. Yes. And there's a lot of great things that you want to feature here.
Absolutely.
Some of the things that you're going to be bringing forward to us. Okay?
Sure.
Yeah. Anything in closing you'd like to say, Bill?
Well, first of all, thank you for doing the show with us. I appreciate
My pleasure.
that. Thank you, Mike and Tammy, for orchestrating the show. I want to thank our colleagues again, and I want to thank our community, because our community really supported us throughout COVID. They donated stuff, they donated food, they brought in masks. We had a lady in Ashland that sewed 100 masks for us, hand sewed 100 masks. So I want to thank our community for their continued support of Lehigh Valley Health Network, and more importantly, their support of our colleagues.
Now, friends, you notice the enthusiasm that Bill has? Well, the enthusiasm runs throughout the entire hospital, in fact, the entire network. And so when you see these healthcare workers, they're under a lot of stress, and sometimes a smile or a thank you, it goes a long way. I know, those nurses, practical nurses, the receptionists, everyone does their best, and sometimes we don't know what they just experienced with a patient, and we were too quick to judge. But thank you again. Keep up the good work. Believe me. Okay, keep that healthcare going.
Thank you, Sam. Appreciate it.
And folks, we'll see you next time.